Alrighty, Kelisha. So basically, what we are going to ask here is, 1 year or this year, what do you think, or do you know that we are going to accomplish, or what are we going to do? So have you heard, or do you have any hopes?
For the 1 year, I hope, and so it's been talked about,
Right.
of getting a new rig for here. 3 of them aren't in that great a shape, and the miles are up there. And so we definitely need a new one. And I think if they would have taken into the consideration of the money that they've spent into 3 of the 4 of our rigs, then they could have at least possibly gotten 2 and left one of them that with the better of the higher mileage, in a reserve unit to keep. But I think if they would have utilized that money that they've already spent and realized that they could have already gotten some new ones.
And I've seen that, not just here, but other spots too that I've worked. And it seems like if they just would take that money and buy new,
and trying to save money, it's like, oh, we'll save money, we'll get it fixed, but then it's like just one time after another, after another, after another, and it all adds up to where it's by that time you've got so much money built into trying to fix one of the rigs up that you could have already had one purchased, if not 2. And you don't have to go with a brand new one. You can go with one that's a demo that doesn't have that many miles on it, just simply running from one place to another. But they're just as well as a brand new one, and you can get them cheaper. So.
And you don't have to get the fancy either. You don't have to get the fanciest one with all the buttons. And
you don't, but I definitely wouldn't go with the Transit.
No.
It's too small.
Yeah.
Especially whenever you have either a trauma patient in the back, or if you have a code that you're working in the back.
Right. And you got responders and
it just
doesn't work right.
It doesn't work right. I've done one back there and it does not work.
And unfortunately, it sounds like that's a new one that we're going to get again. So, all right. So how about in 3 years?
In 3 years, let's see here. There's a couple different things, but in 3 years, if I had to choose, possibly pay would be one. I feel like we have to go through so many things to even receive our license to be able to do what we do, but yet our starting out pay here is, I think, pretty positive the lowest one that starts out here. Environmental services even starts out greater than what we do, and they don't have to obtain a state license to do this. Yes, they do have to have a high school diploma or a GED, and I realize that, but they don't have to uphold a license and go through the class and then get continuing education hours to keep up on their license. So I think pay is definitely one, and the amount of extra work that we do that is outside of our license, because we are based out of a hospital, that it's so much more, but we don't get compensated for that. And I'm not saying that, look at us and look what we do, but, definitely getting some compensation back for more than just working on the ambulance, because of us helping out with patients and working in the ER.
Because we are hospital-based.
Yes, and helping clean rooms or taking a patient to the floor and stuff like that. So I think really getting compensated for the extra work that we do would really be nice.
Exactly. Yep. Awesome. So what about 5 year? What do you see us accomplishing, or do you know of anything that...
In 5 years, what I hope that they would accomplish is, if we are still going to be hospital-based, getting a designated area for EMS to be able to just go and relax for a minute with us working 24-hour shifts, because what we have right now is just like the extra spaces that are open at the moment. So we have access to the surgery lounge, but we can't get it until after 5 o'clock, except if it's on a weekend. Or we have the NPR room, which if colleges have nursing students over here to kind of work and see how things are done, then they take one of the rooms that we go into. So really we don't have any place to just call ours to where we don't possibly get ran out because we're in here, but now they have a meeting, so we've got to go find somewhere else to use.
Right.
So I think if we had a place to be able to call ours and be able to relax and it not have to be in our bunk rooms,
Right.
that would be really nice. And then just to get another room that has beds in it and not hospital beds,
Yeah.
because they just aren't comfortable, and with us having to be here as long as what we are and trying to get rest and make it a little more away from, actual patients' rooms.
Right, exactly.
To where we don't have to worry about waking them up with calls in the middle of the night or vice versa.
Right. Yep. I agree with that.
So that's what I would do in 1, 3, and 5.
All right. Peace out. Thank you.
Deuces.